Good morning, everyone, and welcome to this interview with our friends from Cerner. I'm thrilled that they could join us today. We have Dorinda Sutton, who is the CNO of Cerner Corporation. We have Ashley George, who is the VP of Clinical Products, and we have Tara Cox, who's the Director of Clinical Products. And they carved some time out of their schedule today to talk about what Cerner is doing during this horrendous COVID crisis. So I just want to start by asking Dorinda, tell us about Cerner's initial call. You know, what was your call to action when COVID-19 started?
Yeah, so thank you, Cheryl, for having us. From a Cerner perspective, initially, as we were learning about the COVID-19 pandemic and how it was starting to go across the globe, we initially were following very closely all of the guidelines about initial screening and travel. So our infection control team released very quickly the screening that was following the guidelines, got that out to our clients so that they could adjust the intake and screening forms that they had. And as we started to watch this pandemic go across the world, and as it started to seep into the US, we really realized that we needed to establish a new norm, because the way that we were doing business traditionally was not going to prepare us for what we needed to do to keep up with the daily and sometimes hourly changes to recommendations as we were learning more. So what we initially did from a Cerner perspective, we had a group that was really focused on what is the health and safety of our associates across the globe, since we are an international company, and really looked at some of the initial travel restrictions, but then that quickly led into a work from home strategy. So we are currently in a virtual working environment, as most people are. But from a client and a clinical perspective, we also needed to figure out how to organize differently. So we created an enterprise strategic task force that really, it initially started with 12 work streams, but now has 13 different categories of work that we are doing front and center for our organizations and to help our Cerner clients. So that's really how we have restructured, and that is the new way that we are doing business. On just another additional note, you know, we do have some organizations that are continuing on with any projects that they were doing for new solutions and new implementations. We have about 60% of our clients have continued to move forward with those projects. We have had about 20% of our clients do a halt because they might be in the midst of a hotspot across the country. And then we have about another 20% that have actually wanted to expedite some of the projects that they're doing. So that's what we're seeing across our client base.
Really interesting, especially that about some people really wanting to expedite, but it makes perfect sense because they need solutions in. We had a question from one of our people in the field, Deb Graham, who asked, in a recent interview with Vanderbilt about their standard operating procedures for crisis management, does Cerner have such a protocol or model for their customers? And also, and I think this question goes to Tara, what steps is Cerner putting into place to limit systems changes?
Thanks, Cheryl. I think several different things, and I apologize, allergies are also getting the best of me a bit. So several different things that were put into place early on, as Dorinda alluded to, with our infectious disease screening and our travel screening. But we took a minute to pause quickly and think about how we could direct our efforts to what we would say is a documentation or disaster documentation guide. And that really focused on standards of care. So we wanted to streamline the documentation, but we were also aware that many IT departments are working with minimal staff or don't have the availability to take a large impact. And then also nurses, we don't want to disrupt their everyday workflow. They're already making drastic changes. having to follow their hospital's new disaster plans. And so we wanted to make sure that we were cognizant of all of those things and that our recommendations really were around standards of care and just evolving their current operating procedures. And so some of those things that we've focused on, like I mentioned, are more efficient documentation, making intakes easier, providing better guidance for quick registration. We know, I apologize, we know many of the areas are setting up tenting locations. They're having to expand their hospitals to allow for more beds. And with that comes a lot of new processes and having to evolve even more extensible and mobile workflows through telehealth or video visit options. And so we had to take all of these things into consideration. And so really, like I mentioned, quick registration process, staff awareness through notifications and alerts, thinking through updates to how we could support clients with just visitor policies. So we knew they would be making changes to those visitor policies. As well as they expanded their locations, how would they set up those new locations in their EHR? Could they support new physiological monitors and ventilators with bedside medical device integration? So really just all of the things that they're going through today, making sure that we had a guided standard process for that. And really, like I mentioned, a focus on what that disaster documentation guide should be. And we've been working to evolve that over the last week in hopes to get something out here quickly. I would say the last thing, just a quick note here, would be that we were already really prepared for this as we thought through the essential documentation pieces. And I would like to turn it over to Dorinda, my colleague, for just a minute to talk through how we were already paving a path here to advance what we would say is essential documentation.
Yes, thanks, Tara. So I think from a Cerner perspective, we have been working on an initiative called the Essential Clinical Data Set since the end of 2016, and we actually had some of our initial organizations, early adopters, have it in their system in 2017. It's really, we started off on the intake assessment and got the intake assessment down to, I think, about a total of 37 questions. And then we quickly moved that methodology on to physical assessment for the med-surg patient, essential clinical data set for the critical care patient, OB intake, behavioral health intake. So we've really been able to prepare our clients and our organizations with a streamlined and more efficient documentation process. Now, we have had many organizations that have taken advantage of at least the intake portions of that. So I think we have more than maybe 70 clients and even across the world that have taken this. So those organizations, I think, have already been positioned very well for having decreased the burden and getting rid of the noise from an intake and admission process. We have had other organizations that have been able to take the physical assessment and critical care ECD. So we believe that we have positioned our organizations very well from a documentation perspective. What we have done in addition to that is we are creating, as Tara mentioned, we're pulling together all of the recommendations from a solution and a system build perspective that Tara alluded to. You know, how do we decrease the nurse witness for medication administration to decrease PPE and decrease the burden of nursing? But related to documentation, we have put together a process that helps our organizations who haven't been able to intake, admission, essential clinical data set. And we have a process of how we can get that into their systems and live in 7 working days. So for those organizations that haven't been able to leverage the ECD, we put together some expedited processes. And we are also putting together a holistic toolkit or guide that includes our standards of care, standard operating procedures, and the expedited implementation of the essential clinical data set, as well as all of the other system initiatives that can be implemented to decrease the burden. And I think right now from our client base, they are asking more for guidance around how they adjust their disaster policy. And I think the interesting variance with what we're seeing with COVID is that every organization has a disaster policy, but most disasters are not lasting as long. So how do you have extended disaster policies? And I think that's really what our organizations are looking for. And, you know, to what Patty had shared from a Vanderbilt perspective, what are some of those recommendations around standards of care? So that is all being packaged and available for our clients to have access to.
Thanks, Brenda, for bringing up the minimizing of the PPE as well. I think we've been very creative to try to find ways to do that. And as Brenda stated, just modifying our medication witness workflow slightly to accommodate that, just the little things that we could do has really been essential.
Yeah, I've heard that in several different interviews so far about things that, you know, I really hadn't thought of, but simple but yet very creative ways of changing the workflow to minimize how many people are you know, directly with the patient. One of the things I've also heard about is the whole telehealth, virtual visits, that this is dramatically increasing, even in the inpatient setting. And I'm really curious what Cerner's approach and strategy has been in this area. Ashley, I think that's kind of your area.
Yeah, I'm happy to talk through that. Yeah, I think we can acknowledge now, telehealth is the new normal, right? It is here to stay, and we are seeing the dramatic increase in usage of this. You know, I'd been a part of a lot of different telehealth strategies through the years at Cerner. And, you know, one of the things that I'm seeing now is the quick rise in adoption. And I think I'm seeing studies and research saying that we can anticipate over 1 billion visits will occur this year. And that's just, you know, unimaginable if you were to look at the trends from last year. And certainly the reasons for that is there's been several barriers that have been removed rather quickly over the last month. We've seen where the FCC has approved funding over $2 million to be able to help organizations, providers to get access to the technology that's needed. We've seen the OCR reduce some of their restrictions or easing some of their policies around HIPAA and use of some of these technologies to be able to support telehealth. And certainly even from a reimbursement perspective, seeing of how people can actually get paid, extending services, extending the providers, the location of the patient. So all of that is drastically changed, which in the past probably had been some of the initial barriers. What we're seeing though from the field is really several different use cases, and it's amazing to see the creativity and how the clients are responding to be able in this time of need and crisis. You know, one of the things that we are seeing is certainly one use case is really probably on the inside of the hospital of how telehealth is being used, and really thinking about that is the focus of how do we reduce the exposure to our clinicians and our staff by still being able to provide appropriate care where needed. And we saw where a lot of our Cerner clients have initially responded by even using technology such as Ring to be able to monitor and communicate with their patients when they don't need to have some of those really essential or critical care interventions. I think what we will continue to see though, as Dorinda just said, as this disaster policies continue for elongated times and really putting in some longer term strategies, are more standardized approaches like using Amwell that you know, have the ability to be able to help provide for these virtual visits, being able to use, you know, technologies like Patient Observer that can help continue to monitor these patients. So we're seeing quick adoption of those areas. And it's just been quite impressive to see how quickly, you know, our organizations have responded. I think another use case that we saw very early on was more around the outside of the hospital for those visits. So how they were using the technology of standing up tents and triage centers to be able to manage the throughput of these, you know, critical patients, and leveraging, you know, once again, some of these technologies that we're using today, Zoom, Teams, to be able to help leverage, you know, and support their patients. What we're seeing though, as some of these organizations have stabilized though, is really more of the focus on these more scheduled type visits, and seeing where, how can they just be able to manage, you know, these clinic visits, and a huge rise of that through our partnership with Amwell. And I think it's really telling to see where we are seeing some of these states, even like Oregon, where they're starting to require that all of those type of visits get scheduled through a telehealth system. So, I mean, that's certainly where these projections of 1 billion, you know, visits are coming from. And I think that we're just going to continue to see this as this is the new normal for us. Just like these type of meetings are the new normal for us.
Absolutely. And I think it's going to be interesting to see how this changes us forever.
Yeah.
Because I think it really, certain parts of this is going to change for the way we practice healthcare in this country forever.
Mm-hmm.
So I'm interested, we were talking about disaster training. Dorinda, are there any tips or recommendations that you can share on disaster training for clinical staff?
Oh.
We have been getting a lot of questions from our clients from across the world, actually, but in the US, where it's, you know, those hot spots that are getting ready for the surge. How can we get assistance? So there's a couple of things in training. So we have staff that are at an organization that may be in an ambulatory clinic or a surgery center that are getting pulled to a critical care or an intermediate unit. How do we train those people on what those standards of care are in an unknown or an unfamiliar venue of care? How do we get new people? For example, the state of New York has really relaxed the expired licensures, and we have people that are coming out of, you know, retirement, or haven't had their license updated in a while. How do we even get them back into the workforce? They may have never even documented an electronic system. So how do we get them up to speed? So there's a lot of different variations. And I think on top of that, it's then understanding from each organization perspective what their limited standard of care is going to be around disaster. So from a Cerner perspective, we are helping to provide additional training and onboarding for the reallocation of staff at organizations, but then also preparing training and education materials for those net new people that are coming into organizations. So we are doing that from a virtual perspective. We're providing it from the EHR and the system. How do you know, what are the workflows within the system? We are not addressing anything from a clinical practice perspective. That absolutely needs to go back to each organization to be able to determine what that standard of care is from a clinical perspective. So we are providing all of this from a virtual perspective. The other thing that we are finalizing are, for any of the recommendations that we have put into our system, we have created short videos and e-learnings so that even people that are familiar with using an electronic medical record may not be aware of what some of the specific COVID recommendations are within this vignettes, and we also are using a lot of e-learning that we can just push that out to our organizations to be able to leverage at their systems.
Cool, thank you. You know, I just got a flash in my mind of what it would be like now. I mean, I've been a nurse for 43 years, but I haven't actually practiced at the bedside for pushing 25, except for a little bit. What it would be like to be thrown back into that environment right now, that's very scary, very scary. Um, I've got a second question from Deb Graham I'd like to pose to you guys. She said she read recently that the Missouri Health Connect is offering healthcare providers free access to clinical portal during the public health crisis. What is Cerner doing to share information with state exchanges? And I think that ties into the whole concept of reporting and analytics as an absolutely vital aspect of managing COVID. And what's Cerner's approach in this area?
Yeah, I can help answer that. I think about, as you mentioned, the importance of data and data exchange. And I think there's probably several options within lots of different areas around the HIE, but probably the most preferred method, if I'm understanding her question correctly, is around how Cerner's participating with care equality. And that's really our preferred option. And what that really is thinking about what are some of the common data exchange or the interoperability framework that exchanges that data between these networks. And Cerner has been a big proponent of interoperability in the data exchange. And then I think certainly, that is one preferred method. You had, also touched on, as we think about data analytics and reporting, and this has certainly been a very highly needed area that our clients are asking for, that the industry, the national level, the world level, right, is thinking about. And that's even where, Cerner is approaching this from. Certainly you think about some of the standard or base reporting that you would expect to be able to identify your patients, be able to identify who's been tested and the outcomes of those testings. But then it also moves into how do you analyze some of that data to understand the geographic makeup of these patients and the locations. And then we're seeing some awesome work out of some of our other nursing colleagues at Cerner. Lisa Golker's leading an effort that's really looking at utilization of resources. And what I mean by that is helping to look at your bed utilization, your ventilator usage across your organization, but also at a national level, so that we can share that with the CDC, so that we can actually help monitor and keep track of, where are we, going to be at capacity. And so I think those are some of the quick areas of respond that Cerner's doing around reporting. But then I think certainly there's the other areas around the analysis and the analytics that are so important to this crisis. And what I mean by thinking about the predictive hotspots or the outbreaks that are occurring. And then once again, how can we just use this data from our research for ongoing efforts? So I think this will be a continued area of focus, continued growing area of focus, and it's all around the data and the exchange and how we can help support each other regardless of EMR or EHR platform.
Thanks. That's truly, I mean, the PhD side of me thinks about all the research that's going to need to come quickly and long term about how this impacted the quality of our care. It may teach us things we never even thought of before. So I think that's definitely going to be critically important, and I'm glad you guys are addressing it. How is Cerner thinking about the progression of this pandemic? Because we've all had to come to realize it's not a week, it's not 2 weeks, it's not even 1 month or 2 months. It's going to be for a while. So I'm interested in how Cerner's thinking about that.
Yeah, I know Dorinda and Tara and we've talked about this. Our colleagues are, really putting a lot of thought into this as well. As we think about what I would say, either phases or waves, whatever you want to say, we are very much in the phase one. We're in the respond, all hands on deck, whatever we need to do to be able to help cope and do the right things for our organizations, for our patients. But what comes next, right? And I think that we really see that there's probably two more waves, two more phases, you could say. You know, in the second phase, I would classify that more as a recover phase. And some of the things that we anticipate or are thinking through are what will be some of those spikes in elective surgeries that now, you know, when we're able to resume some of those activities, how will we respond to those and the capacity to be able to meet those across the world? Thinking about when we've missed some of these health maintenance or annual screenings or vaccinations, you know, how do we think about, you know, getting back to that and what does that look like? And then even more from a technology or from an informatics perspective, you know, Cerner's thinking about what does it mean for us as the timing of release of new products, of code, and, you know, the readiness of clients to be able to handle that. I think then we, you know, contemplate really that third phase though of, you know, redefining what does this mean to the industry itself. And we will redefine what our care delivery models are looking like forever. And I think that is probably one of the biggest things as we look at scope of practice and how the teams are working together as a care team and really thinking about the modes of how we've delivered care have changed. And it'll be certainly something to learn from. And then also on a broader world level scale of how do we think about this data and the surveillance to be able to, you know, combat these pandemics in the future.
Oh, I totally agree with you. So is there anything else y'all haven't covered that you would like us to know about how Cerner's responding about this, kind of to tie everything up here?
Yeah, Cheryl, I think there's a couple things that we would just like to highlight. You know, one of the other things that we have really tried to do for our organizations is provide just a single place for organizations to come to understand what all the Cerner recommendations are. We have a place for our clients to be able to share lessons learned. For example, Evergreen, who's been in the epicenter, has been very willing to share all of their lessons learned that they are compiling on a daily basis of how they are treating what the clinical care should be. So we've done a facelift to try to continually improve what that one source of truth is from for all of our Cerner clients. We provided there what any of our recommendations are that are updated frequently on a daily basis. And like I said, those lessons learned. This is where we also have just one single source of truth for all of those surge guides. But the other thing that has been a little bit of a change from a Cerner stance is we are also now publicly sharing on our Cerner.com site a lot of our recommendations. And that typically, you know, I think that's an example of how you see organizations changing their business behaviors in a time of crisis. You know, that is something that I suspect that many vendors have probably been a little proprietary in what they're sharing at their open, you know, their Cerner or their .com sites. So I would share that. The other thing that we've really done and taken to heart is we've created a client council. We have organized in the US 12 hospitals that range from some of our large, big academic multi-state organizations. We have included the DoD to understand learnings that we're getting from the Department of Defense and the VA, as well as critical access hospitals and what are all the nuances and what they need help with. That has been a very engaging group of sharing, but we're also leveraging them as our field operations, bringing back into Cerner, what else could we help you with? And then I think I would like to end on just sharing something that we've done for the Cerner associates. Our HR department has made adjustments and created a pandemic policy that we are encouraging if any of our clinicians, we have probably close to 900 to 1,000 clinicians that work across Cerner. If any of our clinicians want to take advantage and volunteer to work in the front line at a state or local level, we are honoring that personal wish, and we'll be providing the salary support, and the pandemic, and our pandemic policy will cover them while they are out helping in their local communities. We have so many that are of us that, you know, live just across the world, and we are all being touched by what's happening at the local and state level. And this was something that from a Cerner Corporation perspective, we felt was very important to make sure that we, you know, provide the support to our clinicians if they do feel the need to go back to the bedside and help out.
Well, that is just super to hear. I applaud you for that forward thinking attitude and for sharing. If there's anything you want us to share through the informatics community, please do not hesitate to send us links, documents, whatever you have. We'll certainly, I think the more we can share it and interlink so that we can get all resources to all people, I think the better we'll be. Again, my thanks on behalf of Ania and all of us in the informatics community for doing this interview today. I wish you guys every good thing, and please stay safe. And it's been a joy. Thanks.
Thank you.
Thank you, Cheryl. We appreciated the time that you've been able to spend with us. And yes, we hope that everyone else stays safe as well.
Thanks. Bye.